Hi, this is KCCK's Culture Crawl. I'm Dennis Green, and my guest today is Tom Cook, who's written a new book about the Ponseti Method of treating clubfoot. So first off, welcome, Tom.
Well, thank you. Nice to be here.
Before we talk about the book, tell me a little bit about your life and career, because I know that you kind of came at this from being a physical therapist.
I initially came here to the University of Iowa as a faculty member in physical therapy. And after 15 or so years, I transitioned more into public health. So I was professor of public health for a number of years. And along the way, I worked with Dr. Ponseti back in 1992 when he was doing a 30-year follow-up of some of his patients he had treated 30 years previously. And then I officially retired from my faculty position, but then started working full-time in the College of Medicine with the Ponzeti International Association. And Dr. Ponseti was still alive at that time in 2005, 2006. So I worked with him pretty closely in some of the efforts to promote his technique internationally. So that's what I've been involved with since, and continue to do what I can to promote the Ponseti Method globally through the Ponzeti International Association at the university.
Well, let's go back and talk a little bit about how the Ponseti Method came about, because I'm familiar with the story, and I'm sure a lot of people are. But for those who aren't, it was a method of treating clubfoot, which was a fairly common malady, but up to the point that he developed this method, the only treatment was, surgery that often didn't go well.
Yeah, exactly right. He came to the university, actually was involved in the Spanish Civil War in 1936. Day after he graduated from medical school, the war broke out. He spent 3 years working in the Spanish Civil War and developed a great admiration for the value of immobilization and plaster to heal war wounds. He was on the losing side. He went to France in a concentration camp. He went to Mexico as a general practitioner, and he arrived in Iowa in 1941. And shortly thereafter, he was assigned to do a follow-up study of patients that Dr. Steinler had treated surgically. And after examining the first 20 or so patients, he realized that as adults, these individuals who had been treated as infants surgically were pretty miserable. They had arthritis, they had stiffness, they had pain, and resolved to find a better way to do it. Based on his experience with plaster and immobilization early on in his career, he thought, why not see if we can't just progressively straighten out clubfoot, a condition with when the child is born with their feet turned in and turned down severely. So he said, let's try to do some gentle manipulations, put on a plaster cast, wait a week for the tissues that are stretched to tighten and the ones that are tight to stretch. I equate it to orthodontics for your feet. Where you
like braces.
Exactly.
Sure, exactly, yeah.
The orthodontist doesn't go in surgically and rearrange your teeth and say, now you have a nice smile. They apply gentle pressure and let, as Dr. Ponseti would say, let nature correct her mistake. And he found that after 4 or 5 weeks of applying and reapplying a cast, that you could progressively straighten the foot and turn it into a normal foot. All the normal tissues are there. They're just out of alignment and they're sort of lopsided.
So it's a series of casts, but a pretty labor-intensive process then for those months.
Well, for those 5 or 6 weeks, the child has to wear a plaster cast. The actual manipulation or the adjustments that occur are described as gentle manipulation, so there's no pain involved for the infant. I mean, ideally, they start the treatment at a week or 10 days after birth. So by the time the kid is 6, 8, 10 weeks old, the foot is straight and they don't know the difference. We have many patients who were treated, have nice straight feet, normal life, and have to look at their baby pictures to see that they had clubfoot, or talk to grandma or somebody, because it's just that innocuous, and the kid's going to have a normal life.
Has the method of the treatment changed at all over the years since Dr. Ponseti first conceived of it?
Really, no. In fact, part of the issue we deal with a lot is that modern day physicians want to change it. They think they can do it better.
It's got to be a better way.
Yeah, they can use different materials. They can do it more frequently. They can, and the fact of the matter is, just the way Dr. Ponseti had it figured out by the the late 1940s, has really been proven around the world to be the most effective technique. There are studies from dozens of countries that show that you can get 95 to 98% correction rate, whether you're in Uganda or Uzbekistan or Pakistan or Nigeria or wherever.
Well, and again, using materials that even a third world country would have access to.
It's hard to envision anything that's more cost effective and more effective in terms of changing a life. Plaster, even in Nigeria, is $4 a roll, and $4 and 2 rolls of plaster, and you can put a cast on a kid. So 4 or 5 casts. So what, you've got $20, $30, $40 worth of plaster, and you've changed a kid's life. So it takes a skilled practitioner, someone who knows about how to manipulate the foot and apply a finely molded cast. It takes plaster, and then, like with orthodontics, there's a tendency for the foot to return to the deformed position. So the kids need to sleep in some pair of comfortable shoes with a bar connected to keep the feet turned out and up a little bit. Otherwise, there's what's called a relapse, so it'll recur. Now, if it recurs, you can fix it again as long as you haven't surgically disturbed the tissues.
The book is called Clubfoot, The Quest for a Better Life for Millions of Children. Tell me how that idea came about.
Well, I, after working with Dr. Ponseti and working in countries in many places, I just felt that the story needed to be told, the intertwined story of his life and how he came up with this technique, as well as the need to promote this technique. An interesting part of this whole thing is that he had this figured out by the late 1940s. We recently interviewed a lady who's in her 70s now who was treated in July of 1948. And she's been a hairdresser. She's been active all her life. She kayaks in her retirement and stuff. But Dr. Ponseti went for several decades trying to convince the medical community they didn't need to do surgery and that he had a less expensive, non-invasive way to do this, and he didn't get much traction. And it was not until the late 1990s, when his information got posted on the internet, that parents started coming to Iowa and started paying attention and demanded that the medical community pay attention to this technique. So it was really the parents that finally did what he wasn't able to do on the medical side for literally for decades.
Rotary International has been involved in this as well.
Yes, Rotary has been, as the last 4 or 5 years, has been a major partner. With the 1.2 million Rotarians around the world and 30,000 some clubs, they're in every community, or mostly every community. And their goal, of course, is to provide service for community needs. And this is a need that's everywhere. There are 200,000 children born every year around the world with clubfoot. And they're born everywhere. The U.S., every country you can think of, 1 in 750 live births. So 1 every 3 minutes, in fact, somewhere. So they're in perfect position to help out. And they've provided, through their global grant process, they provided us the resources, partnered with Ponzeti International, to conduct training programs to train healthcare professionals in a variety of countries to do this technique. That's the first part of the puzzle. Is you have to have a trained a physician or healthcare person, doesn't have to be a physician necessarily, who is skilled enough to do the treatment. And then it's just a matter of plaster and braces and other support, getting families to the clinics. They have to come back every week to get the cast refreshed. So there's a need for transportation and sometimes food for the rest of the kids, or childcare, or whatever other logistical items that might be obstacles. And Rotary is perfect for that. They're right there, grassroots in the communities, and they just in many places have stepped up to help out in that regard.
Well, you work with Ponzeti International. What does is the training, does that take place around the world? Is the university still kind of an epicenter for this, or how is that? What's the structure look like?
Well, all of the above. We have a steady stream of physicians and healthcare people who come here to the University of Iowa as sort of the mecca, the epicenter. It's continued under the guidance of Dr. Jose Marquende, who is basically Dr. Ponseti's protege and worked with him for 10 or 15 years. So we have a steady stream of doctors. I think we have one coming from Poland and one from Uzbekistan next week. They come for a week or two, typically 2 weeks, to really learn the nuances of the technique. In addition, we have a lot of train-the-trainer programs. So Dr. Marquende works with individuals. I think he's made over 200 international trips in the last 10 years to do training programs in upwards of 70 or 80 countries. And we try to establish centers of excellence in selected locations so that the local healthcare providers can be trained locally. Obviously, we can't train everybody. We estimate that we need somewhere around 4,000 trained practitioners and clinical centers around the world to treat these 200,000 kids. So we have centers of excellence in Lagos, Nigeria, Karachi, Pakistan, Bogota, Colombia, in Mexico City. So we work continually with those centers to help support the training that they do there for the people in their country. And ultimately, these children will continue to be born every year. So there's a new supply. There's 200,000 patients every year. So we need not only this generation of practitioners, but the upcoming residents and the new people to learn the technique and to learn it well.
The book is entitled Clubfoot, The Quest for a Better Life for Millions of Children, and you have a reading and signing event coming up at Prairie Lights, yes?
Yes, next Thursday, the 13th of February. The book's also available on Amazon and Barnes & Noble and actually direct from the publisher.
Which is, that's Ice Cube Press, right?
Ice Cube
yes?
Press,
Yep.
right here in North Liberty. It's pretty widely available, and we've gotten some good feedback. And a big part of writing it was to inform parents, because you can imagine when parents have a child born with what looks like a deformed foot, they panic, they feel guilty, they need to understand what it is. And basically, it's a kind of a random genetic event that just happens. It has nothing to do with positioning in the womb or nutrition of the mother or the lunar eclipse or some of the things that we learn from in developing countries. And we think that the parents involved need to better understand the technique and I think benefit from the history involved in how Dr. Ponseti got where he got and why.
Well, Tom, thanks so much for telling this story. It's an amazing story that's benefited so many kids around the world, and yet another thing that has grown up right here in Iowa.
Yeah, I think it is. One of the taglines we use for this Ponseti method is Iowa's gift to the world, and in a very real sense, it is. It's a simple technique that can be done anywhere, and is life changing. And we're very happy that it originated here in Iowa, and even happier that the people in Iowa and Rotarians and others around the world are actively supporting the dissemination of this technique.
You can hear Tom talk more about the book and pick up a copy at Live from Prairie Lights on February 13th, or, of course, find the book on Amazon or at the website for Ice Cube Press, which is icecubepress.com. Tom, thanks for being here.
Well, it's a pleasure. Thanks for having me.
You can hear The Culture Crawl live on the radio most weekdays at 10:20, or download the podcast, watch or listen on your own schedule at kcck.org/culture or using your favorite podcast app. I'm Dennis Green, and I'll talk to you later.